when to take a pregnancy test for the earliest accurate result. Last week, one of my patients came in panicking. I've taken 5 pregnancy tests over 3 days and got different results each time. Today, I'm going to solve this confusion once and for all. I'm Dr. Handan Namlı, obstetric gynecology and fertility expert, and I'm revealing exactly when to take a pregnancy test for the earliest accurate result, not just the earliest possible line. The timing tip in this video has helped hundreds of my patients avoid the emotional roller coaster of uncertain results. The testing confusion. First, let's understand why timing matters so much. In my previous video about HCG, the pregnancy hormone, I explained how this hormone only enters your bloodstream after implantation occurs. But what many don't realize is that HCG levels rise in a specific pattern that affects testing accuracy. When testing too early, you enter what I call the maybe zone, where HCG levels might be just at the threshold of the detection. This creates those heartbreaking, faint lines that leave you wondering. The key problem, most people test based on when their period is due, but that's not actually the most reliable approach. Here's why. As I covered in my video 8 hidden pregnancy signs before your missed period, your body gives you clues about pregnancy well before a test turns positive. But to confirm with a test, we need to understand the exact timing of implantation. The signs of implantation. Implantation, when the embryo embeds in your uterine lining, happens approximately 8-10 days after ovulation. This is when HCG production begins, not at fertilization, as many believe. But here is what makes timing tricky. Implantation isn't instantaneous. It takes 1 to 10 days to complete, and only then does HCG start entering your bloodstream in detectable amounts. From my clinical experience, this means most women won't have detectable HCG in their urine until at least 10-12 days post-ovulation. This explains why in my video about early pregnancy signs, I emphasize symptom tracking alongside testing. Remember that specific type of cramping I described? That implantation cramping can be your first indicator that it is almost time to test. Home test versus blood test. Not all pregnancy tests are created equal. Home urine tests typically detect HCG levels around 25 milli-unit per milliliter, but some early detection tests claim sensitivity down to 10 milli-unit per milliliter. Blood tests performed in your doctor's office can detect levels as low as 5 milli-unit per milliliter, making them able to confirm pregnancy 1-2 days before even the most sensitive urine test. Let me walk you through a comparison. Blood test timeline can detect pregnancy 8-10 days post-ovulation. Most reliable 10+ days post-ovulation. Advantages: quantitative results showing exact HCG levels. Standard urine test timeline can detect pregnancy 10-14 days post-ovulation. Most reliable, more than 14 days post-ovulation. Advantages: convenience, privacy, immediate results. If you are anxious to know as early as possible, blood testing is your best option. But if you are willing to wait, a home test can be just as accurate if used at the time right. The optimal testing strategy. Here is my exact recommendation for the earliest accurate test, not just the earliest possible line. Track your ovulation precisely. As I explained in my fertility journey video, ovulation predictor kits or basal body temperature tracking are much more reliable than calendar calculations. Wait until 12 days post-ovulation minimum. This gives implantation time to complete and HCG to reach detectable levels. Use first morning urine. This concentrated sample has the highest HCG levels. Use the same brand of test for comparison. Different brands have different sensitivities. The 48-hour rule. If you get a faint positive, wait 48 hours and test again. HCG should approximately double every 2 days in early pregnancy. What your test results actually mean? A truly positive test, even a faint line, means you are pregnant. There is no such thing as a little bit pregnant. However, very early positives should be interpreted with caution. A faint line meaning likely indicates early pregnancy, could indicate very early pregnancy loss, chemical pregnancy, is definitely not caused by evaporation lines which have no color. A negative test meaning with symptoms present. Test again in 48 hours. With no symptoms, likely accurate but confirm once more after missed period. As I discussed in my video about the 8 hidden pregnancy signs, symptoms sometimes appear before tests turn positive. If you are experiencing those specific breast changings or unusual fatigue I described before, trust your body enough to warrant retesting. This approach has helped hundreds of my patients avoid both false hope and missed early pregnancies. Whether you are actively trying to conceive or anxiously waiting to know, testing at the right time makes all difference for your peace of mind. If you found this helpful, you'll definitely want to watch my video on the 8 hidden pregnancy signs before your missed period. It covers the physical changes that might tip you off even before a test turns positive. I'll link it right here in the description. For those at the beginning of your fertility journey, check out my complete guide on the truth about getting pregnant, where I cover everything you need to know about maximizing your chances each month. What was your experience with early pregnancy testing? Did you get an early positive or did you have to wait? Comment below. I'd love to hear your story. I'm Dr. Handan Namlı and I am here to guide you through every step of your reproductive health journey with evidence-based information you can trust.